It's some 42 minutes after 7. You're welcome to my banner. Our talk today is around Danida withdrawing from Ghana, the impact on the ordinary Ghanaian and the health sector. We know there are big spenders in our country doing a lot of collaborations with other NGOs and civil society organization groups as well. I've got two individuals joining me on this particular conversation. Charles Otney Abbey is Acting Executive Director, African Development Program, and Mr. Gabriel Benaku is Chairman of the Coalition of NGOs in Health. Good morning, gentlemen.
Good morning, man.
Let me start with you, Mr. Benaku. I mean, we've been talking about funds for the health sector like every time. We need a lot of money in this area. One of the big spenders, big collaborators is Danida. What would it mean? Or can we first of all assess what they actually even do in Ghana?
Yeah, thank you, and good morning to Ghana, and good morning to all my regional chairpersons. We are in a retreat now in Accra here to look at the health sector budget and its implication in 2016.
Okay.
And then we'll come out with a policy statement on whether or not our health financing for 2016 is adequate or we need to do something for additional funding. When we talk about Danida support to the government of Ghana, it is something that we cannot even quantify. Apart from the monetary terms, the impact is so enormous, so great that we cannot even measure. But as a civil society organization, having worked with Danida in different projects in the country, I quite understand the great impact of the work of Danida. Now, there are two major issues I want to highlight. One in the health sector, how Danida have financed our health systems in Ghana. And then two, in the private sector, how Danida have supported civil society organizations to deepen our democracy and influence health outcomes in the country. So in terms of government, Danida has always been one of the backbones of financing our budget every year in Ghana. I do not have the figures. The Minister of Health should have the official figures. But they have always supported us in programs, service delivery, human resource, and infrastructure. So there's no doubt that the withdrawal of Danida will not have impact in our health. It will stress actually our health. And we will not see it now. We will see it after 6 months, 1 year ahead. That's when we'll start feeling the impact. The other aspect is that Danida has supported civil society so well. For example, the coalition of NGO having partnered with Danida in terms of mobilizing civil society to play their watchdog role. And I can say is the effect of the work we do with Danida. That's why you can see the coalition of NGO very prominent, very vibrant in reasoning with government in the health sector and advocating for certain reforms. That is the work that we have enjoyed from Danida, capacity building for civil society. Then they have also supported, CHAC in so many ways. You see that CHAC is very vibrant in the country. They try to, apart from providing the services, they also hold government responsible and accountable for certain flaws that happen in the health sector. And so, without any hesitation, I will say that the withdrawal or the exit of Danida in financing our health sector is a great impact negatively. Unless, of course, the government, Ministry of Health, develop new strategies to respond to these shocks. I'm quite aware that, yes, the government of Ghana was informed 5 years ago that there will be a time that Danida will withdraw, and more specifically 2016. But I was so amazed yesterday to notice that even though this notification and the exit plan was there, people were not aware. Major stakeholder in the health sector was not aware of some of these critical decisions that were agreed with the NIDA and the government of Ghana. So the honor responsibility lies on the Minister of Health vis-a-vis government of Ghana to now begin to look extrally and innovatively how we can map up strategies to increase funding in the health sector, because already the health sector is stressed up in terms of budget.
But yesterday I listened to the health minister say that this is not going to impact negatively. But let me bring you into the conversation. Let me bring you. Yeah. You want to react to that, but let me give Mr. Charles Otney Abbey the opportunity. But let me also just say that development cooperation between Denmark and Ghana began as far back as 1957, and Ghana is today one of DANIDA's major partner countries. So it means a lot to our country. Mr. Abbey, what do you think the impact would be?
Yes, thank you, Mama V, and good morning to our cherished viewers. I think that taking off from where my colleague left off, maybe is a reflection of failure to always look at the fine details as a country. We don't read. Because the health sector support program, DANIDA, kick-started as far back as 2012 with the government of Ghana. You would find in there that they had signaled this intention that they will exit their support
in 2016.
Yeah. More so because we have attained a middle income status. So really one expects that the PPME unit of the Ministry of Health, which is the Policy Planning and Monetary Evaluation Unit, would have, noted this issue as a strategic risk or threat to our health sector financing, because indicative budgets from the health sector supports program by DANIDA, that over the 4-year period of their supports, they were going to invest close to $64 million in Danish kroner terms, over 440 million Danish kroner terms. So yearly amounting to an average of about $15 million, which is substantial. And more importantly, the component this support goes to was to help with the Ghana Accelerated MDG framework, and to the effect that they were supporting us towards the MDG 4 and 5, reducing child mortality, improving maternal health. And over 80% of this support goes to this sector. As far as the DANIDA support for government of Ghana health sector financing is concerned, indeed, the study of their document will show that as far as the MDG 4 and 5, DANIDA support and funding for Ghana's plan of actions constitutes close to 13% of development partners' funds devoted to helping Ghana realize the 2015 MDG goal on Goal 4 and Goal 5.
Yeah.
And so critically, and more so when you look at the status of progress on our attainment of Goal 4 and Goal 5, yes, Goal 4 we have made progress looking at the reducing the number of under 5 mortality per 1,000 deaths. We have made some progress, and it's indicative that we could meet the targets. But then on the maternal health issue, the picture or the status of the indicators is it's unlikely we are going to meet maternal health. I remember when a woman goes to child delivery and the woman doesn't come and the child doesn't come, and has implications for the family, for economic. So really, it is without saying that it will have impact even at the lowest level.
Okay, let me not to cut you, but let me bring into the conversation via Skype now the First Secretary Health Danish Embassy, Lena Hoots, joining us via Skype. This is really at their doorsteps. Let me find out why they are pulling out, even though it would have implications on us negatively. Hello, Nina. Good morning. Thanks for joining us.
Thank you for having me, and thank you, Paul.
So, Lena, you've always indicated that this collaboration, particularly your supports with the health sector, would end in 2016. But do you think that we've achieved, together where you thought we would be in 2016? Are we there?
You could say for right now, as our colleague right before said, that on maternal health, we are not there. This is why, we are not out yet. We're still in 2016, and we're still together with the EU, who's also contributing quite a substantial amount to the MDG acceleration framework, as was mentioned before. It was supposed to end in 2015, since it was an MDG acceleration framework. Due to different things, it was delayed. But we have quite confidence that most of the plan will be implemented in 2016 actually. So on that point, I hope that we will reach our goal. Other of our goals has been to strengthen the Ghana health sector in general. We've been giving general budget, sector budget support, where we have been strengthening different parts of the Ghanaian health system. And hopefully these capacities that has been built and the systems that have been built are sustainable and will last also after the NIDA leaves.
There's one more thing which is not over yet, I think until 2018, which is the Tax and Development Program, correct?
Correct. Well, we also have a decentralization program where we support the DDF and decentralization, where health was supposed to be decentralized by now. That process has also been delayed a little. And then we, as you say, have the Tax and Development Program, where we strengthened the Ghana Revenue Authority in order to get more revenue in Ghana, which will hopefully also be used on health. And then we have the support to private sector program, which will last until 2020. So we're not out yet.
So, in your mind, and I think that in our books, it's because when you look at the books, we're doing better as a country. But the people living in the country would tell you that we're not doing really well. Would you consider, for instance, the collaboration with health coming back or not withdrawing your support?
I don't know whether you've been following Danish politics, which you probably have not, but we are actually we're cutting quite a big deal development aids all over the world, and the health sector program has not been cut. We live up to the deals and the agreements that we have signed on to, and it has already in 2012. It was agreed that this was the last phase of the health sector program. It started in 12 and will end here in 16. But I agree with you, when you look over your shoulder and go out into the country, you could question the middle income status.
Exactly.
Yeah. You sound, like you're disappointed in us in a way that we haven't lived up to.
No, if you have seen what progress have been made in the Ghana health sector the last 20 years, it's incredible. How far? I don't say that we are there yet. In the Danish healthcare system, we have many issues also, and in the Ghanaian health system, you have many issues. But it's come so far. There's been so much progress that when I have colleagues or partners who were here 20 years ago, they are amazed how much progress has been made, also in the countryside, also in the rural areas. So yes, there's challenges that has to be faced, but progress has been so incredible in the Ghana health sector that I don't think that we should lose sight of that. I know there's challenges, but we also have to see, where did you come from, and where are you, for example, compared to other countries in Africa.
So this is close of 2016?
Yes.
End of 2016, and that's it?
Well, it's it for the health sector program. We continue collaboration in other areas. For example, we just approved 3 new research projects within health with Ghanaian researchers and Danish researchers that will last over the next 3 years. We still support UN agencies that operate in Ghana. We still support civil society within sexual and reproductive health and rights through the Amplify Change Fund. And we also are trying to increase our private-public partnerships with the Danish companies and promote that here in Ghana.
Okay.
So I wouldn't say that we are out of the health sector. We are out of what we could call the bilateral development aid, yes, but in many other areas we will continue collaboration with Ghana. We have very good collaboration with Ghana internationally on politically on health issues. So I wouldn't say that we are out of the health sector. We are out of bilateral aid. That's correct.
Okay. All right, Lena, we'll leave our conversation here. Thank you very much for joining us via Skype.
Thank you so much. Have a good day. Bye.
Bye. That's the First Secretary Health with the Danish Embassy, Lena Hutz. We still rely very much on AIDS.
Sure, Lena is a diplomat. To a large extent.
So she's being diplomatic.
Yes, she's being diplomatic. But then the stark reality is that for maternal mortality issues, like I said, we've not made, yes, from 1990, we've made some progress, but huge challenges remain. For which reason, so long as this aid is getting out, then we have some gap to fill. And the posturing and language of the Minister of Health yesterday, listening to the interview with your colleague, was quite worrying. It sounded like, okay, so we would plan, we would like to, and I'm like, wait a minute, handing over notes that were given him, this should have been one of the issues noted. And what I've expected that in the 2016 budget provision, if you look at the ABFE, the funding from the oil and how it is disbursed, you have about $8 million being allocated to health infrastructure. But you have as much as over $28 million going to fund scholarships. And if you look around, you know that much of these scholarships go into oil and gas accounting and what of those things. But reading the health sector support project document of the Danish government, you find out that they identify some serious threats to our ability to rake in extra resources to support our health sector financing. And corruption is one of the issues identified there. In fact, you know, Lena will polish it, but really in the document, you see that they paint a picture which we already know, that really the macroeconomic stability is not so much as it's supposed to be. For that reason, we are unable to consolidate our resources and then block leakages that would go into supporting. I mean, for crying out loud, if they see how much money goes through by way of leakages from the system, yes, you say $64 million over a 4-year period is good, is substantial, but look at the other side of the coin. How much have we given out by way of corruption, illegal payments we've paid out, and all of those things? So I think they, as development partners, also sit on the fence and see these things happen in the country.
Yeah, and why should we continue to use our tax payers' monies into these projects when the people themselves don't see the work?
Exactly the point, and they're also shifting their focus towards economic diplomacy and engaging more in the area of private sector development, because they see that, yes, we are signing contracts here and there. So, okay, there's business in Ghana. Let's position ourselves to move into that sector.
I get it. So this is a message coming from Richard from Yala, who is watching us. Richard says, Moavi, ignore what the health minister said yesterday because we don't trust them. We trust people like Charles and Albert. Okay, so where do we go from here, Mr. Benahu?
Yes, we already, Ghana have developed a very comprehensive strategy to address our health system challenges. One of them is the National Health Insurance, and then the other one is the chip compound strategy. Now, what it means is that without any delay, we should come out clearly on how we want to finance these two major interventions in order to reach universal health coverage.
Sustain resource in them.
Yes. And we already have a lot of resources in Ghana, except that the Ghanaian will want to see clear accountability, transparency, before we can really be able to raise enough funding within Ghana to support our health sector. We are challenging the Minister of Health. They should show a clear transparency and accountability issue in the health sector. The reason why I'm saying this is that if you look at the chip compound construction all over the country, we are yet to see a standard chip compound draft document. How much will it cost? If a chip compound is being constructed in Accra here, how much will it cost? If another one is being constructed in Kumasi,
are you saying we don't know?
We don't know. We have different quotations for chip compound construction, different, what do you call it, draft, or what I call different models of chip compound. So but
we should identify a model and stick to it.
We should agree on a standard and how much it will cost. For example, USAID is supporting chip compound. They have a rate for construction of chip compound. JICA is construction chip compound.
They also have a rate.
They also have. Government of Ghana is construction. They also have. The communities are also the communities are also doing something to represent as chip compound because they don't have. So they are using self-help to construct. What is the standard for a chip compound? and how much will it cost? What is the average cost? So it's not just about the president saying that I'm taking part of my salary, my ministers and my DC and my MPs money to construct chip. No, that goes beyond that. Practically, how much would an ordinary average chip compound cost?
So I guess what you are essentially saying is that in order for us to move forward and carry out all these projects that these people help us with, we have to be accountable to ourselves, and we have to be transparent.
Clear on our transparency and accountability. We just don't say DC construction compound. And that's the funny thing. We are worried about it. In the recent health review, annual review at the district level, you hear the DC will say, I was told to construct at least 2 chip compounds in my district.
There's a classic story in, I think, the Chronicle newspaper about a chief who has decided to stop the construction of this is rooftop, like a ceiling, because it costs so much, and he didn't understand why the assembly would spend 400 million Ghana cedis on that.
Why?
You know.
So that is very unclear, and I think that the Minister of Health, Ghana Health Service, which is the main implementer of the health sector programs, should bite and push the politician to do the right thing.
Right.
There should be effective collaboration between DCs, MPs, and other private sectors who wants to support chip compound construction.
Okay.
But it must be standardized, so that we don't know whether we can have more or we can have less. But it must be standardized.
Okay. Charles, I'll give you the last say.
Mama V, you see, I mentioned that certainly when I interjected when my colleague was mentioning that government of Ghana estimates for chip compound would be higher than, you know, and really, you check the figures, you see it. But the reason why this support, withdrawing support will trouble us is that if you look at the Ghana Living Standards Survey, recent round 6, if you look at our rural poor people, those who consult a medical facility when they are ill, the rural, the very poor and the poor. If you look at the baseline of 1990 and currently, the reduction is very marginal. Those who actually consult a health facility. And in our poor areas, really the rural savannah and urban savannah areas, it is the CHIPS facilities they will attend. And they will expect that the CHIPS facility has at least a nurse present, because ordinarily the medical doctors will not want to go there, but the nurse will be there. If you look at people accessing these health services, the records are not, very positive.
If we have a district,
what kind of impacts will this have directly on NHIS?
Well, for NHIS, I do know that the DENIDA was supporting a technical advisor to help them with the financing and system issues. So once they pull out, then
so that's human resource
off. So I'm not sure about monetary support to the program, but that will be the impact. But if let me finally add that the way forward on this matter, I expect that if the Ministry of Finance would come back to Parliament with a supplementary budget, then civil society
in an election year,
civil society. I mean, listen to Honorable Atokas of Forsen. I could foresee a supplementary budget coming. I could foresee.
But wouldn't, too soon?
No, but the basis for their calculations, I mean, using the oil revenue, they pegged it at a certain point.
But the city is stabilizing, I think, from the reports of today.
Just the first quarter. But do well know that in the first quarter, businesses are now picking up. More so when Guta has declared strike, because taxes, their capital has reduced. So the volumes of imports they could have done to trade, put all of those things in context. But really, should a supplementary budget come to Parliament, one would expect that coalition of NGOs and health society, think tanks of ADP, would push the debate to the point that the ABFA funding allocation to health, we should make a case such that it's not quite clear for me that you have about $8 million for health infrastructure and $28 million plus for capacity funding for scholarships. Really, where are our priorities? Because it's about human development, it's not only about the macroeconomic indicators of inflation, of GDP and what have you, access to health services and for that matter, quality health service, availability of medical personnel at those places. And this is where we should be putting our money as a people. And we'll have to look at this, financial arrangements right.
I'm sure everybody can understand why organizations such as Danida, IBIS and Co would collaborate rather with NGOs rather than, continue sticking with government, because you can see through what civil society organizations do. We'll have to leave our conversation here. We'll see what happens, how we move on after Danida's exit, particularly in the health sector, which is such a big deal for all of us. But we'll look forward to your review, the budget review on the health sector as well.
Yeah,
then we'll do some analysis.
Will come very soon because we already have two indicators. We have the 2015 State of the Nation address. We have the recent one, 2016. So we're going to do a lot of comparison. And we'll come out with statement. And we are going to look at the impact of Danida in the health sector. How it will be, and make possible alternative suggestions to government to take pragmatic actions on that. Okay.
Sometimes I'm a little rebel. I think this is an election year. There's a lot at stake. So make your findings known to all of us, ordinary people. Let ordinary people understand the situation and how we can move on.
And
let's push the leaders to commit to something so that we can hold them to it.
The presidential candidates must come onto this light.
This is your time.
Yes,
this is your time. After 2016, you won't get them to commit. But thank you so much for being here. Gabriel Benako and Charles Otney Abe. Coming up next, Roland Walker. He's got AM Talk with our members of parliament right here. Stay with us.